Okay, our next presentation
Yeah.
is on the Jessamine County Health Department and Harm Reduction Services. They offer an extensive variety of resources, especially when we're talking about harm reduction and the expansion of programs through the past couple of years. Our presenters are Sydney Bishop and Shauna Onan. Okay, thank you.
Thank
You
you.
want this?
No, I'm just gonna hang close to her.
We're really loud.
Yeah, I am really loud.
Hello, everyone. First off, I want to say thank you, Angela, for all that hard work that 988 does. We interact with 988 quite often at our health department, so I just wanted to say thank you for the work that you do. So my name's Sydney, and this is...
I'm Shauna.
So we present quite often together, and we are yo-yos. So we really feed off each other. We go back and forth. So that's why we don't want to hold a microphone, and we both are really loud people. So I also didn't want to blow your ears off. So that's why we're standing up here without a microphone. So a little bit about me. My background's in social work. I started with the Jessamine County Health Department as a caseworker. I'm now the harm reduction director, and I love what I do. Very passionate about what I do. So it might sound like I'm trying to sell you all something, but I promise I'm not. I just really love my job and where I work. So no sales pitch. But yeah, so I've been with the health department for about 4 years. And again, I love it. And it sounds like a lot of you all are harm reductionists yourselves. I know you all hold different jobs and do different stuff with safety and prevention and all those things, but that's exactly what harm reduction is to us. So.
Yeah, and I'm Shauna. I've been at the health department almost 4 years now too. I'm a person in recovery. I've been recovering for over 5 years now. And I'm also in school to complete my bachelor's degree that I started almost 20 years ago.
That's awesome. All right, so I'm not a person also that likes to read from a screen. There's the professional definition of what harm reduction is. But to us, it's just giving a person respect. It's giving a person dignity. It's focusing on the substance disorder up front and not just saying, you know, this person's an addict or using words like junkie to describe a person. We really care about the person up front. And of course we do other things. We educate on safe sex, we educate on safe disposal, and we do all of those things, safe sex practices. But like I said, I feel like everyone here is a harm reductionist, and honestly, health departments, for all the years work that they've done in our state, it's truly harm reduction from WIC to HANDS, all programs that are involved, coalition work, is reducing harms. And we all have the same goal here, is we want to make our people safer. We want people to stop passing away from reasons that they don't have to. So that is what harm reduction is to us. Next, I just wanted to give you all a quick history of JCHD and syringe exchange total. So I don't know how many people are familiar with syringe exchange in Kentucky. I also move around a lot. Public speaking is not my favorite thing. So syringe exchange hasn't been around forever in the state of Kentucky. It's a fairly new concept. Jessamine County Health Department was actually the 4th syringe exchange program in the state, which some people would be like, okay, that's kind of cool, 4th in the state. But Jessamine County is a very small county compared to a lot of your Louisville cities, your Lexington, your Barron counties, all of those huge communities. Jessamine County, our small little county, had a syringe exchange. So we've been doing this since 2016. It started with a grant, and it's just kind of exploded from there. Shauna and I were hired 2 years ago with the OD2A grant. Robert in the back that was here, he sits on that grant. But it started because our county was recognized as being always in the top 10 for having overdoses. Whether intentional or not, we were recognized as that, and that's not something that we want to be recognized for. So our syringe exchange started in 2016, and now we have a peer-driven focus. So everyone who works in our syringe exchange has some type of lived experience. Our director, Ann, she's here. She also loves public speaking, so feel free to chime in. But she really focuses on having peer support there, having a person who with lived experience is working with those people who are actively using substances. So I love that. Not a lot of people have syringe exchanges in the state of Kentucky. It's not, you don't have to have one. You don't have to have one in your local health department. Not even half of our counties in the state of Kentucky have syringe exchange programs. So it's really unfortunate, but I feel really fortunate that my community and where I live and where I grew up has a syringe exchange. And we do a lot more than just, syringe exchanges, and that's what we're gonna get into, is all of our programs. So like I said, in 2016, a syringe exchange started at the health department, but now we have all these other programs that are harm reduction focused. And I love it because when you say harm reduction, to anyone, they automatically think it's just syringe exchange, and we're so much more than that. We're preventing STDs, we're preventing HIV, AIDS, we're going out to rural communities who may not have clothing, who may not have food, sunscreen, condoms, they may not have access to Narcan, and just simple ways to get in contact with your doctor, your primary care, mental health, 988, all of those things. So we try to do a lot, and I'm going to go in and break them down and try not to talk fast because I have a long time to talk. Okay, syringe exchange program. Let's start on that.
Okay, so I was originally hired to be the syringe exchange peer. When I came into harm reduction, my focus was on getting everybody that came through the door into treatment. Since I've been working there, that has changed for me. We get to be that peer, share some of our personal experience, connect with the individual, and then start leading them towards a place of safer using practices. We are a one-to-one syringe exchange, so for every one we give out, we need one back. That's to help keep the community cleaner. We give out fentanyl test strips, xylazine test strips. As you guys know, the increase in the actual passing away of people from fentanyl is at its all-time high, and now we're seeing the xylazine, and we have seen pictures, we have seen our people with those xylazine wounds, and we actually give them the tools, the Vaseline and the, what is that gauze called?
The
Zero form, yeah. So we give them all of that. We do HIV and hepatitis C testing. That's through a partnership with the University of Kentucky. We refer out to treatment, and that can be any kind of treatment. That could be inpatient, outpatient. It could be medication, just whatever that person needs. We also teach harm reduction practices like minimizing your risks, safer sex practices. We do TB skin tests and any kind like vaccinations. We do vaccinations. We will use the syringe exchange to connect them with our primary care or prevention medicine. Okay.
We also connect a lot in our syringe exchange with community members. So if we have someone in the community that has a sober living, or they may have a rehab center, they can come and volunteer after they take some trainings. They can come and volunteer to sit in that booth. Our police, we have a great connection with them, but they can come and they can actually sit and talk with people who are actively using. Our police really support our syringe exchange, which is something you don't hear in a lot of counties. A lot of counties you hear that it's us versus them. And our police do a really good job at knowing who our people are, not prosecuting when fentanyl test strips were against the law. And if they recognize like, oh, I see you have a Jessamine County Health Department bag, so that automatically connects you to them for the syringe exchange. They know that they can call us. We've been able to build that relationship. They can call us. We can connect them with services. We can get them into rehab or into mat therapy if that's something that they want. So a lot of the times people just walk in and they check in with us because a lot of our folks are houseless and are in and out of our community, but they know we're a safe place. And I think that work is what matters the most in syringe exchanges. We're not just here's your supplies, bring back your syringes. That's not our focus at all. Our focus is you're going to come here, you're going to be loved, we're going to give you some hope, we're going to be there for you when you actually need help. We're not going to turn you away just because you may do something that we don't agree with. We really try to reduce the stigma in our community, and a lot of our work is focused around the syringe exchange and just making sure those folks are educated as much as possible.
With our mobile harm reduction, we applied for a grant, right, like, what was it, 2019, and we were able to get the funding and purchase a mobile unit. This van goes out to, right now, it's 4 places in the community regularly. They set up, they offer HIV and hepatitis C testing. They do the mobile syringe exchange. We, again, connect our clients to medical services, mental health interventions. A lot of times the peer, when she's on there, she will work with them and get them registered for the phone through the government, those government phones. Sorry, I'm real nervous. I don't do well up here public speaking, so just.
You're doing great.
But we do Narcan training for the community. We host those trainings, and we encourage all community members. We think, and the message we put out is we're not going to get out of this on the individual level, that we all need to come together, and it's only together that we're going to find the way through this disaster or this epidemic of substance use disorder and people dying every day.
Yeah, so how we pick those spots for our mobile unit, we use a lot of working again with EMS, with police, and just asking them, where are your hot spots? Where are you all seeing overdoses? Where are you seeing a lot of our homeless populations that are using substances? Where are you finding syringes on the side of the road? And that's how we identify where our mobile unit goes. We don't just go, to Kroger and pull up and say, hey, syringe exchange. We do go to rural spots in our community, places that are living in poverty. So we really try to identify those places, and we're really big about cleanup as well. A lot of people, that's the first thing they think about syringe exchange, that we are enabling folks, that we are giving people syringes. So that must mean you're saying, go do the drug. We are very much about educating them, bringing your stuff back to us, and also giving that clean supply to them so we're not spreading diseases. So,
yeah, and when I was in active addiction, just to kind of bounce back over to what Sydney was saying about enabling, I was going to use. It didn't matter where I was or who I was with. When I had that itch, I was going to use. So the ability to withhold clean supplies from people is not doing anything for the use, other than making them at a higher risk of spreading infectious diseases in the community.
Mm-hmm. Yeah. So we also have an overdose map, and we also use UK data to recognize where those hotspots are in our community. And then we also ask our syringe exchange participants, where would you all like to see this? We have people that come to our syringe exchange from Fayette County, from Garrett County, Mercer County, Danville. We have people from all around, and we keep that data. So we serve more than just Jessamine County, even though we're just a Jessamine County Health Department. But people know they're going to come to us, and they're going to be loved. Like I said, they're going to be educated. If they need something, they can come to us, and we're going to help them. We do not turn anyone down. We also, like Shauna was talking about, our Narcan trainings. She actually goes to the schools. Shauna has made a really good rapport with the police department. So the police ask her to come in once a year now for our sheriff's department, our police department, our EMS, and our fire. And she actually tells them a little bit about herself, her story, and they get to ask her questions because, again, it's a lot of us versus them. So a lot of I'll keep saying our homeless population, but that's the majority of what we see. But our homeless population, they don't trust the police. They don't, because they're always getting, ran off from wherever they're sleeping or whatever it may be. We're trying to connect that. So they get to ask Shauna a lot of questions and have an actual conversation and open dialogue instead of, you know, this person's bad or run from the police. So we've tried a lot of molding around stigma and trying to change the outlook on it. So we also use a social media app in our syringe exchange and on our mobile unit. So all of our LGBT communities, it's very a quiet thing in our community, unfortunately. It's still very stigmatized. In Jessamine County, again, we're smaller, more conservative town, so we try to make sure we reach every population. And how we do that with that community is we do discrete testing. So our teammate Rebecca, she's hired through UK. She gets on social media dating apps and will put out an advertisement for discrete testing and can go out into the community and set up and have discrete testing where someone may be closeted is the term, I think. They may not be out. We see a lot of people who are married who need discrete testing. So we try to give that service as well to those folks.
So the transitions program, we started this program when I was hired. My original job after I got out of the syringe exchange was to be the peer support. The program was for the OD2A grant. I was going to go into the detention center and lead smart recovery meetings to connect the inmates with resources to ensure that we want to break the cycle. We want to end the return to use immediately after being released from detention centers. And instead of our people are going back to drug use, I'm really sorry. Like, I don't know what's going on with me. Like, I'm just stuttering. But anyway, so we were going to go in there, and our goal was to reduce recidivism, was to reduce the amount of people passing away from fatal overdoses upon release. The OD2A grant, when COVID hit, we had to revamp things. So now we have a diversion plan or program in the court system, in the circuit court system. Hannah goes to court. She's our case manager. She goes to court and she meets the people, and we conduct an orientation on the following week. We get to go into the jail, and I get to meet a lot of our people in there to see if they're interested in the program. We offer smart recovery meetings and case management services every week. The transformation took place between COVID and, I'm sorry, Sydney, like seriously.
You're fine,
like,
seriously,
no,
you're
like
fine.
I am like, yeah, so.
So the Jessamine Transitions Program,
sorry,
you're
I don't
fine,
normally
you're fine.
do this.
You're fine. So it was a learning process for us, and we actually have an upcoming presentation on this, just specifically on this program that's given at the health department, because it's been federally recognized, and I'm gonna toot my own horn just for a little bit because we put in a lot of work in this program. Like Shauna said, we were supposed to be initially in the jail giving reentry services, and we were told we weren't allowed to do that anymore, and we figured out, well, how can we still meet this population? How can we still figure out the incarcerated population? How can we still help them? Because if they don't decide to come to our health department, you know, we're still not helping them. So what can we do? So we actually went to our Commonwealth attorney and we asked him, is there a way that we can still meet this population? Is there any openings in the court for us to, you know, show up? And the only thing at that time that Jessamine County courts offered was probation and parole or drug court. And, you know, a lot of those people fail a lot of those programs. Those are very hard programs to get through. And for low-level offenders, you know, that may be a lot for them. They have jobs, they have kids, they have a lot of responsibility going on in their life, but they're struggling with substance use disorder. So what that does is that puts that in our program, and they can work with Shauna and a caseworker for 26 weeks, and they work that program. They go to class, they do check-ins, and they have a whole list of requirements that they have to check off in order to complete. And then at the end of their completion, we hope to have them set up for some type of success, whatever they define as their success. So that's been a pretty cool and new program to Jessamine County. We usually stick around, 40 participants a month. We're given, I don't know, maybe 2 to 4 new folks every 2 weeks. So it's still growing. At the beginning, people were very confused on what we were doing, and the goal is just to keep people out of jail, to keep people from stop dying, to give people a new way to live, and that's really hard. So we have been, and Shauna really has been that helping hand for those people, and having a peer support that's able to walk them through the system. It's really hard to understand. It's really hard to learn. But having that lived experience, I think, has been vital in the growth of our program. And later on, next you'll learn a little bit about smart recovery, which is where you shine in.
Yeah.
But our programs have really taken off in the past 2 years.
Yeah, and I have past experience with drug court. So prior to my willingness to change the way I was living, I was arrested at 36 for the first time and was given drug court. I was very unsuccessful. After 2 years of failed attempts, I was terminated and I was put in the detention center. It was Lincoln County then. So I get to teach people smart recovery. Smart recovery is a 4-point program. We talk about building motivation to change, coping with urges, managing thoughts, feelings, and behaviors, and living a balanced life.
See, look at you. That was great. That was great.
Well, going back to what I know. This is what I know. So I used a lot of my lived experiences and the mistakes and the failures that I have in the past to connect with people and to show them that the suffering really ends when we say it ends. It didn't end until I came out and was willing to do something different. And a lot of our people have survived various traumas. That's the vast majority have had some kind of childhood trauma. And so being able to share that with them and bond with them and build that level of trust and compassion, we have been really having high success rates. Smart recovery teaches me tools to teach our people on ways to assess their lives and implement tools to get different results. I remember being in the madness and people saying, the definition of insanity is doing the same thing over and over and expecting different results. And in the madness, I couldn't see that. I just remember thinking that, well, I got away with it for 25 years. Why can't I get away with it now? And for the last 3 years, I was after that memory. I was chasing that memory of being successful. And I get to share that with our people because that's where they are. They're now getting those consequences. They're now having all of these negative interactions. And when we get locked up, we come out. I had a friend ask me one day, sorry for my broken language there, but my friend asked me, Shauna, why does somebody go to jail and serve 15 years and get out and the same day they get high? They do the same thing that put them there. And my answer is because we come out the same way we go in. There's nothing that happens in there. And so all we know is how to get and use drugs. And over time, that just consumes us. And I tell my people all the time, I'm like, guys, it ends when you say it ends, and let's do something different today. If you want to it's okay to want to, just don't do it. Call me first. Let me talk to you and give you something else to do. Smart recovery is empowering, it's motivating, and as they put the work in, they will start seeing the results of the different thinking skills and the actions that follow.
And we chose smart recovery, one, due to our guidelines that our grant said we weren't allowed to do anything that involved spirituality, AA, NA, celebrate recovery. We weren't allowed to do that. And as a health department, we may not want to do that. That's not serving every population. So Smart Recovery does that, and it's worked really well for our people. So you can see the first year we did this, we only did it for half of a year, and she had 335 people. And then it exploded last year. So now our drug court, our probation and parole now utilize Shauna to send folks to her class, and they can get credit for those classes. So not only are we Jessamine Transitions Program, we are drug court, we are probation and parole, and now they have a way to cognitively think about all those traumas, all those situations that they have may have gone through, and now they can work through it with Shauna using a model that's not, spiritually based. So it goes into a lot of the brain, it goes a lot into emotion, and if people want to still, use a higher power, Shauna is experienced in AA and NA, and she helps them do that as well. So she's able to meet them wherever they're at. And I know a lot of recovery programs say that, but anybody who uses a harm reduction model truly does that. We meet the person where they are at. So our other program, this is a fairly new program. This is the Mobile Integrated Health, so we call it our MIH team. And this is a team made up of a peer support and another caseworker. So again, this is brand new to us, but it's really exciting. This is the second round of the Overdose to Action grant. So it's a 5-year grant. And the reason we decided to have a caseworker and peer support is because we've seen that work so well at our health department in the transitions program. So if a peer support is there and they have that connection with that person, but they need further referrals or further resources or someone to call and make an appointment with them, teach them how to ride the bus, teach them how to properly take a shower, properly take care of yourself, wash your clothes. There's that caseworker there to help them. And again, none of that is in our job descriptions. None of that says the health department does any of that. But that's what harm reduction, again, it is. It's teaching that person how to live a better life. So we're really excited for this. But so this grant, we partner really, really close with EMS. And our EMS, they're phenomenal. They are nationally accredited. They have community health paramedics, which other communities have, but they don't do the buprenorphine induction. So if someone is overdosing, and Shauna can describe this in just a moment, but when someone's overdosing, I don't know if you all have experienced that, but when they are Narcaned, they wake up and they're very angry. They're sick. They're agitated. They don't want to do anything but run, go find more drugs, and use again because they're dying. They feel like they are dying. The flu times 10. So what this EMS provider can now do, and there's all different types of research out there. And I could talk about buprenorphine forever, but they can ask the client if that's something that they would want. And then the caseworker and the peer support can give follow-up services to that. So the next day they can go in and say, hey, did that work for you? Do you want to continue using that? Can we get you set up with a Suboxone clinic, a methadone clinic? Or do you want to try some type of recovery services? Do you want to go to rehab? So there's that person there that we can connect with the health department to give them those other harm reduction services. We also educate them on withdrawal because sometimes, if they're newer, they may not know. They may not know what withdrawal can do to their body. A lot of our population thinks that you're just going to get sick, you get agitated. Those are the main ones, but it can do a lot of different things to your body. And like I said, we're able to connect them to resources in the health department, and not just harm reduction services. A lot of times we may have young mothers that need services, so we can connect them to WIC, to HANDS. If they haven't gotten their vaccinations, we can connect them with that. So that's a really exciting program. I'm excited to see it grow and expand. But again, it's new, it's exciting. I don't have a ton of information on it. I can just tell you the stuff that I've read. So that's our new project upcoming.
All right, so our Nalox Box program, we have a local ASAP board in Jessamine County. And through that ASAP board, we write for the funding. And one of the things that we were awarded year before last was we were able to purchase 10 Narcan cabinets or Nalox boxes. We have those put up in strategic areas like Sydney spoke about earlier, the OD map. Those are in those areas, and we have in the parks and in the courthouse and the pharmacies, people can at any time go up to them and take a box of Narcan. A lot of people, they don't want other people to see them. We have a lot of that in Jessamine County, carrying Narcan. A lot of our people in the program don't want to, well, they say they don't want to carry Narcan because they're afraid of the judgment. And we just really promote the fact that coming together and saving a life is not enabling. We have the Shepherd's House. We have 2 outside. One is at MedSave Pharmacy. It is outside the building, so they can pick it up at any time. And then over at the Shepherd's House, and we actually just put one in. I forgot about that in front of the health department. But the goal is to put as much Narcan in the community or naloxone in the community to reduce, if not completely negate, the amount of people that we're losing in our community, because then that just, perpetuates that trauma in families in the community. And like Sydney said earlier, we're very lucky to have so much support. Our first Nalox box went in over at the jail in the lobby. And that was, again, us trying to figure out how we were going to get some education into the inmates' hands as they were walking out. And by having a lot of the COs are happy to educate as they are booking somebody out, and they will tell them, on your way out, pick up a box of Narcan. Don't die. Like, you are at an elevated risk of passing away from an overdose. So take some naloxone and go to the health department. A lot of times is what they say. But just getting that Narcan into as many people's hands in the community as possible is reducing the amount of overdoses that we're seeing in the community, or at least overdose calls. Maybe not the number of overdoses, but at least the 911 calls.
Yeah, and the jail lobby has been pretty successful. We have to refill it. It holds 12 kits. We check on it twice a week, and it's always empty. Or the jail will contact us and ask us to come back over and refill that. But that's what we want, is we want those inmates to understand that their tolerance is significantly lower than what it was when they went in, especially with withdrawing. They may get, excited and use more than what they are used to using, and then you throw in fentanyl and xylazine and all the other crazy stuff. They are at really high risk of overdosing. So we're excited that we're able to partner with the jail and they let us do that. Other places that have been pretty successful are our gas stations in our community. Our gas station Nalox boxes are set up in between, like the bathrooms, so male, female bathrooms. We try to set it up in the middle or in a discrete spot. And we refill those constantly too. We probably do those twice a week. And then we just put up newspaper stands, but they're Narcan stands. And we put those out throughout the community. And you can see we've already given out, this was the last week number, but 512 kits. They are empty every week. They hold 24 kits, and we go there every week and we refill those. So people are utilizing them. Again, stigma is a huge, huge issue in our community. People are terrified, but it's so great when we get to talk to a mom, or we get to talk to an aunt, or I go into the schools and talk to kids and they say, hey, I took one of those kits from the park. I didn't think that I would ever have to use it, but I actually Narcaned my mom, or I Narcaned my dad, and thank you for saving my parent, or thank you for saving my brother, or my brother got this Narcan for me, went to a party and Narcaned his girlfriend. It's amazing to hear those stories, that's the impact that we're having by just going out and putting out a box of Narcan. It's so simple. So we have a lot of fights ahead of us. Again, they're brand new to the community. A lot of people aren't liking them, but those stories are rolling in left and right. So it's great to hear all the lives that it's saving. So doing great work. Our next program is our HIV or hepatitis C treatment at JCHD. So we started this in December, and this is a partnership with the University of Kentucky. We were hired because these rates were spreading throughout our community. And again, we are identified as an area that has high HCV rates, hepatitis C rates. So we asked and worked with our director, and she's figured it out. She's figured out how to partner with the University of Kentucky to offer telehealth services in our facility. So we may not be able to have a full-time doctor, but she found a way to have someone that's there that's able to provide this resource, have our nurses draw up the labs, send those off, and then connect them with UK providers. So that has been a pretty good success. I think people are still kind of standoffish because it's always been in this community that you have to be clean. You have to be clean from using any substance. You have to complete a rehab program. And then if you relapse, then you owe like $80,000 to be treated again for hepatitis C. So a lot of our work right now is like decreasing all of that and like kind of like, okay, y'all, like you can come here. We're going to help you. You don't have to do all that. You can be seen. You don't have to, stop using, or, of course we educate on safe use and all those great things, but they get to come to us and we get to offer that service. So it's been really great. And right now we're trying to work on other types of testing that we may be able to use for this on those hotspot areas. So people that can't get to our health department, we would be able to go there and collect some type of lab. So, all right.
Oh, and the Leave Behind program. This was another thing that ASAP sponsored for us, or was part of the sponsorship. This is where, prior to the community paramedic and the other OD2A grant, our paramedics came to us and they said, hey, we're going on a lot of these calls and we are seeing people re-overdose. Like Sydney said earlier, when we are Narcan, I overdosed 7 times when I was using. I quit, they were all intentional. I quit overdosing on heroin after the 5th time and started using other substances. So I understand when we come out of that, we're sick. Like it is the worst flu and stomach virus at the same time. And a lot of our people were going out and using again, which would cause them to re-overdose. So we put together a bag, and in the bag we had fentanyl test strips, Narcan, a CPR mask, and a lot of resources. And it said, when you're ready for treatment or whatever we can do to help you, call some of these numbers. So what year did we start that, Sydney?
21.
21? Is it on there?
Yep.
Oh, yep, I see it now. Yeah, so we put together these bags and gave them to EMS, and because a lot of our people do not want to go to the emergency department after an overdose. So EMS will hand them one of these bags and then give them some education prior to leaving to try to lessen the likelihood that they have to return to the emergency department, or that we lose them due to an overdose.
Yeah, and then from this program, that's how our mobile integrated health team has come about, because they've seen the success. Now when our EMS show up to an overdose scene, they're reporting lots and lots of used Narcan kits on the ground. So it's working. But again, it's going to take a lot of time, a lot of people, and a lot of effort. But I think that it can be pretty successful. And now actually our police department is interested in this, and they want to start kind of carrying a couple in their cruisers and have police give those out too as well. Maybe just to, a person that they know is using, or, you could use it on a family member, or, just if they're just going to offer it to people. So we've really exploded. I don't know if at the beginning I even said this, but when I started at the health department, we had 2 harm reductionists. That's it, that focused on this. And again, it was mostly syringe exchange focused. Now we're a team of 10, and we have all these different programs. So harm reduction has worked. We collect our data like no other. We make sure that we have that because other health departments now can call someone who's experienced it. This is political. I never in my life thought I was going to have to deal with politicians, but I do. I never in my life thought that I was going to do as much research as I do, but I do. But this has been a really cool field. It's been amazing to learn and to see people come to the other side of it. See someone start from literally meeting them in jail and then being sick and throwing up and crying and feeling like a terrible human being and they just want to die and they just want to get off the face of the earth, to all the way to getting their kids back, to finding a partner in life, to getting a job, to paying off all their fines, not being scared just to walk down the street that they have a warrant out for their arrest. Like, it's truly amazing to see the transformation, and I'm so thankful for the health department and everything that they do. So one thing I do want to do is, Shauna does have an incredible story, and I think it has a really positive impact on people who may think differently of our population. So I want to give her time to share that if that's something that she wants to do. But I first want to ask if anyone has questions. We have a lot of programs. Oh, yes, ma'am.
So is there like some dream thing that you would love to offer that you're not doing yet?
Oh my gosh. And you know, there's all kinds of things that I would absolutely love the health departments to do. At a state level, I would love to see at least every health department be able to offer that service, to be able for someone to walk in and at least get clean syringes so they're not contracting HIV and hepatitis C. That would be a statewide thing if there was some type of legislation or policy that could happen at. As far as like locally, I just would love to see people talk about it. You know, there's a lot of people who refuse to even talk to us about the subject because there is so much, there is a lot of politics and a lot of, there's a lot of things. So I would love just for people to talk about it, you know? And like just basic things like people like to be able to take a shower and, you know, have a roof over their head and have somewhere to sleep at night and, you know, just basic things like that. That's not so much health department, but just having basic needs met, you know, just to be a human. I don't know if you all know Maslow hierarchy of needs, but like to meet that bare minimum of living a life, like breathing. So that's what I would love to see, but I could talk to you forever about that. Thanks for the question. Yes, ma'am. Yes, so Anna behind you, she also works at our health department. She just said that. So I totally forgot about my awesome AmeriCorps people. So we have 3 AmeriCorps folks at our health department. One of them is in all areas, so he gets to see all different kinds of stuff, but our other 2 are really focused on harm reduction itself. And what's really cool about AmeriCorps is they can have any interest that they want, and they chose us, and it's great, but they've learned so much. So one of our AmeriCorps, she has lived experience, and then the other one has a master's in public health, and she's really got to learn if this is something that you want to do. It gives them that opportunity to really figure that out, and you know, if this is something that they love. And we've been able to actually connect them to all different sorts of resources and communities, and I hope to bring them on board. So AmeriCorps has been awesome. We've been able to extend a lot of our services because of them and having them there. The No Locks Box program has exploded because of them. So I'm thankful for them.
Everything that you're saying is exactly, with our health department, it's exactly the same way. So I do have another question as far as, is your harm reduction program inside of the health department?
Yes, yep, all.
Do they have a different, do you all have a different entrance or?
So when before I started, there was a different entrance for our syringe exchange folks. And the argument for that, from what I've heard, is that people didn't want to be seen, that it was more discreet for them to come in and do their exchange. But after doing study, after talking to people with lived experience, it actually was very stigmatizing to bring someone through a different entrance, because a police officer that knows where a syringe exchange is, if you're taking someone through the side door versus the front door, well, why can't they come through the front door and get any service instead of just their syringes? You know, and they're easily identified in that way. So they come through our front door just like every other person to get our services.
Ours, and I'm speaking for Lee County.
Okay.
We're part of the Kentucky River District Health Department, so we cover 7 counties. So Lee County, we're very fortunate to have something called the Hub.
Yes, I love the hub. Joanne's great.
Yes, so, I mean, I do all Joanne's ordering, I was literally just ordering for her. But, so whenever we first started, in the health department, what we were seeing was our other services were going down. And so I think that was kind of the brainchild of moving it off of the campus, which it was perfect because our old health department was literally right next door to our new health department, and it was sitting empty.
Yeah.
So I encourage anybody, if they're interested, to come to Lee County and visit the hub, because it is one amazing place.
Absolutely.
And we are actually starting another hub in Letcher County.
Amazing.
And one of our peer supports, which I'm so proud, I have goosebumps right now, I'm very proud of him. He's actually going to be the director. He's going to relocate and be the director of the Letcher County hub.
Yay,
That's
that's
awesome.
amazing.
That's awesome.
Yeah, no, the hub's a phenomenal place. And then talking about those dreams again, if we could go and have, you know, our own little unit, which actually our health department is extending, and we're all going to be together right now. We're like spread out all throughout the building. But we are building on, and we're actually going to have our own little section in the health department where they can come in. They're still going to come through that front door. But one thing too about our peer supports is they are really educated in the other programs that our health department offers. So we do connect, again, a lot of our moms to those WICs and hand services. Wound care is a huge thing. And our nurses, it's not in their job description, but they love our people and they're willing to help our people. And we ask them to, a lot of the times, check them out. Sometimes they don't want to hear from me that, Sydney, you're not a nurse, you don't know what you're talking about. Okay, well, let me give you to one that does. And if they say, oh yeah, you need to go to the hospital. Oh, okay, that's a great idea, I'll go to the hospital. But it's because it's coming from someone that, you know, is educated and that they trust. So I personally think it's very stigmatizing to have someone go separately, but the hub is amazing. And if I lived there, I would want to go there instead of the health department too. So, yes.
2 questions. First one, you mentioned the EMS thing gives buprenorphine. I understand, like, the person gets Narcan, then they get a dose of buprenorphine to kind of get them okay.
Yeah.
So,
Yeah, so what that Narcan does is it sends someone into withdrawal immediately. So it takes all of that dopamine that you had on your brain, all that goodness and all that high feeling, and it automatically knocks it off of all of your receptors, and you become deathly ill. And it makes you throw up. And again, we don't want someone to re-overdose. So that buprenorphine, they will be giving a low dose. They're not going to start at a high dose at this point until they have more research and have done more. But they are hoping, and what that will do is help minimize that sickness, so they won't go and use a higher dose the next time and then overdose again. To connect them to resources.
yeah.
Yes, yeah.
Yeah.
Yes.
second question real quick is,
Yes.
can you talk, if you're working with these families in your programs and they have children, how do you address that? Is there services, referrals, what, how does that?
So depending on what they want, a lot of my clients that come to me as like their caseworker, they're worried about their kids maybe saw them overdose, or their kids saw them get arrested, and that trauma. So we do connect them to New Vista, which is our community mental health center, and we'll help them set up an appointment for that. And then we also have a really close relationship with our school system. So if the parent is open to letting me tell the local counselor or the mental health clinician at that school, we can do that. We get a release of information, all that good stuff. But our ASAP coalition, we have all different sorts of representatives on there, and they ask that very same question. That's what we try to do, is we all try to work together. It's not going to work if, a recovery center wants to do it their way and we want to do it our way and the schools want to do it their way. Like, it's going to take a whole community to come together and be on the same page, instead of like fighting for who gets insurance and who gets money and who does this and that. Like, it's going to take people who truly care about people to come together to make it work. And I feel so blessed that Jessamine County has that. But that's what we do for our kiddos at this point. I also go in the schools and try to do a lot of prevention in the health classes, but I don't get to do that as often because I'm just one person and I have all these programs. But we do have health educators as well who do other types of education surrounding tobacco and drinking and safe driving and all those things. Yes. Yes, ma'am.
Just curious, thank you.
I don't think I need this, but anyway, tell me, how is the fight against opioid addiction, how is it progressing in Kentucky? Is it, is there anything big happening now, or is it just inch by inch?
When you mean fight, are you talking politically, or are you talking about the drug trend?
Just the drugs, right? Like we're supposedly, there's a lot of addiction in our state, and I was just wondering, over the last few years, what's the trend?
Yeah, Kentucky continues to increase in the drug trend. We continue to increase in overdose. I know the governor released that there was like a 4% decrease in overdose death, but that's not enough. Of course, I think that a lot of that is probably due to places like the Hub, places like your health department giving out all of that Narcan. I think it can be attributed to that, but that's only, a dent in it. Kentucky is starting to see a lot of xylazine, which is a drug used to make animals go to sleep for surgery. And what that is doing is it's causing a lot of wounds. So people are now going inside of detention centers with huge open wounds, and they're not being cared for. Or they're going into hospitals with, not knocking our nurses and our doctors, I love them, but a lot of them are not used to these type of wounds, so they may get misinformation about how to care for their wounds. They're going into rehabs with open wounds, and it's causing causing a lot of infections. So now we're starting to see a lot of people come in with like missing fingers and hands and toes and legs, because it's what that xylazine drug does is it eats at the skin. And they look like little black blisters is how it starts, and it spreads very quickly. Yes, a lot of people will say like gangrene or like crocodile, and it'll spread. So we're starting to see a lot of that. And again, our nurses are really great at helping them and telling them to go to the hospital and doing that referral. But we are seeing xylazine in our community, which is pretty scary. Because Narcan doesn't work on xylazine. So if a person injects that and there's enough of that in there, we lose them. So I expect to see an increase in overdose, unfortunately. Good questions. Okay. Good. We can keep going if you want. Shauna's got all kinds of good stuff.
We have 10 more minutes if you want to use it.
Tell them about just how you got into like harm reduction and like how it's been for your recovery.
Okay, so like I said earlier, when I first came into harm reduction, I wanted to get everybody that I interacted with, I wanted to get them into treatment. My story goes, it starts when I was 10, I was in and out of active addiction. There's very few substances that I did not use. At 40 years old, that's when I decided I wanted to do something different, that I was tired of the consequences. And I was very much an AA big booker when I came into the rooms of recovery this time. So I come into harm reduction. I'm thinking everybody needs to go to treatment. And as I have had the opportunity of working with our people, I've realized really and honestly how isolated they have become. And if I get emotional, I'm sorry. But they are really cut off from society. And when I'm working with somebody and they look at me and they say, "Thank you for being nice to me today," it literally breaks my heart. So I get to be a safe person for them. I get to listen to their stories and connect with them and give them the hope that there is something better out here. Early on, I got a taste of recovery and figured out how amazing life is, and I wanted everybody to get that. But harm reduction has been a process for me. It provides life-saving tools for people who are still struggling, and the goal for us is to keep them alive until they're willing to do something different, until they're willing to try something. We take them all the way from safer using practices to reduced use to controlled use, and that's through a doctor. And then all the way, we've got several that we have started out in the syringe exchange that are in full-blown recovery now.
Peer support.
Yeah, peer supports. A couple are having their own children or children where they're sober. Friend of ours, she had 4 children in the madness, lost custody of all 4 of them. And the last time I saw her, she was coming in and she was so excited because she was going to have her first child out of the disease. And I told her, I said, what a blessing. This child does not even have to know that part of you. So harm reduction for me has been a process of learning and opening my mind. Harm reduction is just like recovery. It is a process, and it's about getting a little bit better every day, every interaction, every step. Reduce the risk and prevent the death. Connect to healthcare. We get to do the hepatitis C treatment. When I was locked up the last time, I was sharing a cell with a young lady who had late stage hepatitis C, and she was unable to get treatment for it because she couldn't pass a drug screen on the outside. So I get to look at our people today and tell them that their life matters, and then I get to show them that it matters by being able to give them a life-saving resource. That's what harm reduction is, life. Yeah.
I love that. I love that. Any other questions? Yes.
A question that I think, Shauna, you should share your educational success and everything that you have, and everything that you've accomplished, because you are truly an example, a mentor, and a lot more than just working harm reduction. You are a living example of the victories that can happen when you have support system. Amen. Right there. So share some, just a little bit of that victory of yourself.
Okay, well, in the madness, I lost touch with my children for 3 years. When I got into recovery, I did reconnect with them. My oldest son, he is training to be a lineman for an electric company here in Kentucky. My youngest plays football at EKU. He's a scholarship athlete. I am currently enrolled at the University of Kentucky part-time, and I have a 3.8 GPA. So my brain usually does not do what it did today. So I do apologize, but I appreciate y'all for hanging out with me. Eventually I start making words.
And I'm going to toot her horn now because she does a lot more than that. She's also our ASAP coalition coordinator, and that entails a lot of time. Our coalition is pretty successful in Jessamine County. She leads Smart Recovery 3-4 times a week. She's a peer, so people lean on her for support at any time of the day, any time of the night, and she makes herself available for that and tries to live her own life as well. Our Commonwealth, our judge, our police, anyone who ever needs advice on what can we do to help people, that's where they go. They don't call me, they don't call our director, they call her because she's lived it and she's gonna tell them about it and give them true advice of what it's like. And I think in order to make progress, that's what we have to do, is we have to start listening to people that are on the other side of it and not our people that are sitting in Frankfurt and have never lived in any experience in their life. So it takes people like Shauna to truly make a difference.
We are worth saving. That drug addict on the corner, they're worth saving.
Thank you guys so much.
Thank you, Sydney. Thank you, Shauna, for sharing that with us today.